In this video, we'll be going over different types of bleedings and procedures. Now, abrasions is when skin is scraped off and there isn't that much bleeding, although infections should be prevented. Now, the wounds can range obviously from larger scale to smaller type, and next comes incisions, which happens when it's an injury caused normally by a sharp object such as a knife or scissors, and it is the most common. Next comes lacerations, when there's a tearing of tissues and they're normally jagged and irregular and may have heavy bleeding, which increases the risk of infections. Now, it's a little bit different from incisions, in which incisions are actually smooth. Step 1 in treating this type of wound is assessing surroundings. Now, as you can see, a man here has cut his hand, and you can see here that there is a cutting board. Once it is determined that it is okay to help, then try to ask the victim if they would like your assistance. Step 3 is to try and put on some personal protective equipment. Step 4 is to assess the victim to see what actually happened to them and determine course of action. After assessing the danger, activate the emergency response system. Of course, it depends on the level of urgency. For example, the difference between a paper cut and obviously a deep wound. Make sure to explain everything properly and don't hang up until they do so first. Treating, you might need some equipment or just some clean cloths. Step 1 for stopping a bleed is to use a gauze and apply pressure on the wound. This will help the clotting process and will help prevent further blood loss. After applying the gauze, apply pressure for 5 to 10 minutes or until the bleeding stops. While still applying pressure to the wound, elevate the body part above the heart. This will reduce the blood flow to that area and would prevent further blood loss. Now, in order to secure the dressing, use a bandage. Now, if the patient is conscious and fully aware, then you can ask them to place pressure on the gauze while you take care of the bandage. Now, for this bandaging process, as you can see, here is a figure 8 being done. This involves going from the dressing, going up towards the pinky and wrapping it around, then going across diagonally and then down towards the wrist in a pattern, thus creating the figure 8 technique. Now, in order to secure the figure 8 technique, grab twice and secure with tape. After done providing first aid, remove personal protective equipment. Now, in order to avoid possible contaminants in the person's blood, then you must wash your hands after removing all personal protective equipment. Of course, this involves setting up warm water and rinsing your hands with water and soap, and this will help prevent the spread of bacteria and illnesses. Some additional notes: if the blood bleeds through the first gauze, do not remove, as it will disturb the clotting process. Just add another gauze on top of it until it stops bleeding through. Second, after it has been bandaged, check to see if it is too tight by seeing how fast blood returns by pressing on the nails and then releasing. If it's too tight, then redo it, and then if it is too tight, it could do possible harm.